So, digitalization, innovation. Here's somebody who knows more. Ran Balicer, you're the Chief Innovation Officer at Clalit Health Services, Israel's largest healthcare provider, covering half the population. So, last 2 years, somewhat unusual. What are the challenges and where is digitalization heading?
I think the challenges in Israel are similar to what most countries are facing. We have basically a sustainability problem in every healthcare system because basically population is getting older, multimorbidity is becoming the norm, patient expectations are continuously rising, and the cost of technology is increasing. All of this meets a lower availability of healthcare workers. And so this increase in demand and reduction in practice of the resources required could bring to the erosion of the system, to the burnout of the existing personnel, into continuous reduction in the level of service and the quality of services. So if you want to change this escalating, basically non-sustainability problem, you cannot just keep on doing the same thing over and over again and infuse more and more money into a failing system. You truly have to transform your most basic process of care provision. The old paradigms of reactive care that is done in a physical encounter and that eventually is quite blind in terms of the outcomes can no longer continue. And we are working hard at Clalit because of the unique availability of resources, of data resources that we have, 25 years of electronic medical record data on every aspect of care, integrated payer, provider lens, very interesting data set. We use it to actually transform care.
And with that unique insight then, with the data that you have, how is that transforming those conversations around digitalization?
So one of the things we've actually taken from theory to practice is the issue of predictive preventive care. For the last decade or so, we have been able to produce in our Clalit Research Institute an increasing set of predictive models that tells to our patients that are going to have a problem in the future, to have an end-stage renal disease 5 years from now, to have influenza-driven severe morbidity in the coming winter. And we use this data in practice to bring it back to the physicians so they can allocate their care to the right patients at the right time and give them preventive services that are cheaper and easier to provide when they are provided early enough. But because they are directed to just the right patients, they are really able to do this and get the proper ROI. What we've done in the last 2 years is create an innovative platform that allows for all of the predictive models to flow into the physician's basic screen. We call it CPI, Clalit Predictive Proactive Interventions. And all of these predictive models, he now walks into the clinic in the morning, he sees which patients he should approach this morning for predictive proactive care. For each one of these, what are the most important clinical domains to intervene? And all of the suggested interventions are brought in a very easy, you check the boxes, you hit go, and this goes directly into the electronic medical records and the recommendations. So you can process many different patients in a small amount of time and truly move from the approach of reactive therapeutic to predictive, proactive population health.
How does this go down with patients? Do they all want to know that they might end up with end-stage renal disease?
There's also an approach that we're trying to take in taking this data direct to patients. What I told you now is actually moving through the physician. And in many instances, it's better because they can actually deliver the message and make it meaningful and impactful rather than just a theoretical construct of you have a risk of X. What is the patient supposed to do with this notion unless there's something that is actually being suggested? So for the patients, we are creating different apps that go into the patient apps that allow them to see what happens if they modify a risk factor that is modifiable. What happens if they reduce their cholesterol? What happens if they better balance they themselves, their specific medical record and the predictions that come out of it? So if I stop smoking, what would happen to my risk of stroke, of cardiovascular disease? And so this is something that is done to turn them in the right way and to suggest for them the specific changes that they can take in order to improve their outcomes. So this is direct to patients. So we're trying both. My strong feeling is that the more effective approach for now is going to be through the physician and allowing the trust in the physician, his ability to process and make the right decisions for every specific patient. That is still very important. This is, I think, what will take general practice to its peak using these type of interventions.
And with this digitalization, the technology, the AI that's involved, are the physicians all on board, or are they saying, You've just given me a lot of data. I know my patients best. Are they on board, or is there some resistance with the physicians themselves?
It's always a gradual process. The first thing you have to do is to design these systems with the physicians and not, throw it at them. So in the designing process, we have family physicians within every step of the process, from the way this is built to the way that we introduced explainable AI into the system that actually tries to understand why the algorithm says this risk and that this and this approach is the right one. So this is not just a black box. This is something that we try to introduce into the system. But also, COVID-19 was a great accelerator because a lot of resistance has suddenly shifted because there was a necessity. So online and telecare was rapidly introduced. And in the same way, we were able to have more and more physicians interested in digital health and in some of the insights that it can provide them so they can provide better care. So we've seen, a great interest, and we are actually putting it into practice. And we hope to be within 2 years to reach each and every physician working for Clalit to be using this system on a daily basis. And this year, by the end of the year, 1/3 of our physicians will be using it.
That's amazing. Well, thank you so much for those insights, Ran Balicer. Thank you.
It's been a pleasure. Thank you so much.